This is the first ECG in our series on the stepwise approach to ECG interpretation. As you know, depolarization of the heart starts in the sinus node and spreads to the atria. This results in the creation of a P wave. Looking at this ECG, we can see that there are P waves preceding each QRS complex. The axis of the P wave is positive in lead 1 and positive in lead AVF, confirming that the P wave originates from the sinus node. Here, the time between each P waves, known as the PP interval, is 1 second, or 60 beats per minute. While we are talking about P waves, we should examine for signs of left or right atrial enlargement. Because the P waves are normal in lead V1 and in the inferior leads, there is no evidence of either left or right atrial enlargement on this ECG. In addition, the PR interval here is normal. Now we move on to depolarization of the ventricles, which occurs when electrical activation spreads through the AV node, down the His-Purkinje network, and into the right and left ventricle, creating a QRS complex. We examine the QRS axis by looking at the orientation of the QRS complex in lead 1 and in lead AVF. The positive QRS complex in lead 1 suggests a leftward activation, and the positive QRS complex in lead AVF suggests a downward activation. This is a normal axis, leftward and downwards. Next, we examine for any abnormalities of intraventricular conduction. It is important to do this before examining for left or right ventricular hypertrophy, as abnormalities in intraventricular conduction can affect the interpretation of signs of hypertrophy. In this ECG, the QRS complex is narrow, and thus there is no evidence of intraventricular conduction abnormalities. Next, we examine for ventricular hypertrophy. For left ventricular hypertrophy, we look at the R waves in lead 1 and AVL, and S waves in lead 3. We also look at the sum of the S wave in lead V1 and the R wave in either lead V5 or V6. In this ECG, there is no evidence of left ventricular hypertrophy. For right ventricular hypertrophy, we look at the axis. Because there is no right axis deviation, and the RS complex in lead V1 is normal, there is no evidence of right ventricular hypertrophy. We now move to assess for the presence of infarction. Here we need to examine for the presence of abnormal Q waves. You can see on this ECG that there are no abnormal Q waves, and the R wave progression from lead V1 to V3 is normal, and thus there is no evidence of infarction. Moving on to repolarization, we examine the ST segment. As you can see, here the ST segment is normal and on the baseline of the ECG, and thus normal. We also examine the T waves and see that they are positive in leads 1 and AVF, and also positive from V2 to V6. This is a normal pattern of repolarization. Overall, this ECG shows normal sinus rhythm at 60 beats a minute and represents a normal ECG tracing.